Hello, and thank you for joining today's session for It's Your Choice Open Enrollment for the State of Wisconsin and Wisconsin Public Employers Group Health Insurance Program. My name is Ryan Olson, and I'm a Senior Client Services Executive with Navitus Health Solutions, your pharmacy benefit manager. During today's session, we're going to provide some high-level information around who Navitus is, what it is that we do as your pharmacy benefit manager, provide you with some information regarding 2026 upcoming changes, as well as provide some key contacts and tools and resources for you to utilize as a member of Navitus Health Solutions. Who is Navitus? So Navitus Health Solutions is a pharmacy benefit manager, commonly referred to as a PBM. As a PBM, it is our responsibility to process and pay prescription drug claims for our members, such as all of you. We contract with pharmacies, and we build and maintain what's called a drug formulary. And we'll go a little bit deeper into what a formulary is on an upcoming slide. A PBM also negotiates discounts and rebates with drug manufacturers. It is Navitus's duty to provide cost-effective prescription drug benefits to our members and clients. Our overall mission is to improve member health and make prescription drugs more affordable. Some additional information about Navitus: we have our corporate office locally located in Madison, Wisconsin, and we have a large operations area in Appleton, which is where our primary customer care call center is based as well. Just to note, all of our customer care calls are handled directly within the United States. As I mentioned, one of our responsibilities is to build and maintain a formulary. So what is a formulary? A formulary is simply a list of covered medications offered to State of Wisconsin Group Health Insurance Program members. We have a group of independent healthcare professionals known as a Pharmacy and Therapeutics Committee, whose goal is to review medications to determine what will be covered on your formulary, ensuring that those medications have a high clinical value regardless of their pricing. This means that covered products will provide a therapeutic value, are effective to treat the condition they're being prescribed for, and have manageable side effects. An additional note regarding our Pharmacy and Therapeutics Committee: when we say that they are a group of independent healthcare professionals, we mean truly that. They are not Navitus employees. They are external prescribers, clinicians, and pharmacists. An additional item to note regarding the formulary is that in the past, generic medications were typically the lowest cost option. That is not always the case today. This is why when you are reviewing the formulary, you may see that a brand product is listed as covered, however, the generic equivalent is not. This is because Navitus will have negotiated pricing with that manufacturer of the brand product that actually makes the brand a lower net cost option than its generic equivalent. Also, when reviewing the formulary, you will see that there are different levels. Navitus has organized the formulary in a way that provides the best value to ETF and their members. These levels on the State of Wisconsin Group Health Insurance Program formulary are structured as follows. Level 1 will include most low-cost, high-value generics and some brands that have a high clinical value and are fairly low in cost. Level 2 will include preferred brand products and some generics that are a little bit higher in cost. Level 3 will include non-preferred brand products and generic products that provide the least value either because they're high cost, low in clinical value, or both. And Level 4. Level 4 is specifically designated for specialty medications. One change that we wanted to call out for the 2026 plan year is a formulary change regarding continuous glucose monitors, also known as CGMs. Currently, CGMs are covered under both your health plan medical benefit and Navitus pharmacy benefit. Effective January 1st of 2026, ETF has decided CGMs will no longer be covered under the medical benefit. Coverage for these products will exclusively be through your Navitus pharmacy benefit. On the Navitus formulary, CGMs are covered at level 2. You can see here covered CGMs include the Dexcom products as well as Freestyle Libre. One item to note, prior authorizations for CGMs will not be required if you are currently utilizing insulin. Our system will look to see if you have previous claims or fills for insulin products. If our system does recognize prior fills of insulin, a prior authorization will not be needed, and the pharmacy will receive a successful claim when submitting for a CGM. If your claim history with Navitus does not include insulin products, the pharmacy will receive a rejection indicating that a prior authorization is required for the CGM, and you will need to work with your prescriber to have them submit that prior authorization request into the Navitus prior authorization team. Some additional information regarding your copays and drug pricing. So the copay that you pay for a medication varies based upon several items. It will vary based upon the formulary level of that medication, as well as the day supply of medication being dispensed, and the pharmacy that is being utilized. Pricing of medication can vary from pharmacy to pharmacy. I like to say, just like a gallon of gas can be different from one gas station to the next, or a gallon of milk will be different from one grocery store to the next, medications are no different. Pharmacies have contracts for the pricing of their medication, so the same medication can cost different prices at each pharmacy. For this purpose, Navitus does offer an online cost compare tool available in the member portal specifically for our non-Medicare participants. You are able to access the portal as well as the mobile app, and you can enter in the medication you're taking, the day supply and the quantity that you're taking, and do a geographical radius search either by zip code or city and state, and you will receive results which will show you what your cost will be for that medication at all of the different pharmacies in your area. This will provide you with direct, clear insight into what you can expect to pay and help you identify if there is a lower cost pharmacy to utilize, making yourself being a smart healthcare consumer. If you prefer not to utilize the member portal or mobile app, or happen to be a Medicare participant where that functionality is not available, you can contact your customer care team. They are available to assist you in locating potentially lower cost effective pharmacies for your medications. Some additional information on these member-facing tools can be seen here. We have member portals for both non-Medicare and Medicare participants. And you can see on the left-hand side that member portal. And what is shown here is what you will see when utilizing that member portal to identify lower cost alternatives and using that cost compare tool. On the right-hand side is our mobile app. The mobile app is specifically available for non-Medicare participants and can be downloaded for both Android and Apple devices. As I mentioned, one of the ultimate goals of Navitus is to help make prescription drugs more affordable. So here we have some ideas and ways to help reduce costs. First, consider using Costco mail order. If you are utilizing a medication on a daily basis, sometimes called a maintenance medication, you can fill through the Costco mail order. Members are able to obtain 3 months of medications for 2 copays. It is important to note that you do not need to be a Costco member to utilize the Costco pharmacy. This is also true for your local Costco warehouse. You do not need to be a member to fill your prescription at your local Costco warehouse. When entering the warehouse, you can simply let the greeter know that you're there only to pick up a prescription, and they will let you through. For those interested in utilizing Costco mail order, they do make it easy to enroll and transfer prescriptions into their mail order pharmacy. Another way to help reduce costs is to consider filling 90 days at your local retail pharmacy. Again, if there is a medication that you're taking on a regular basis, you do have a benefit that allows you to fill a 90-day supply versus having to fill every 30 days and making that trip to the pharmacy every month. The reason we recommend filling a 90-day supply is because pharmacies typically offer deeper discounts for a 90-day supply than what they would offer if they were filling 3 30-day supplies over that same 90-day period. Depending upon the medication and placement on your formulary, your copay as a member may be the same. However, it is important to note that because of those deeper discounts that pharmacies offer for 90 days, the cost that is paid by the State of Wisconsin Employer Group Health Insurance Program may be less for a single 90-day supply versus 3 30-day supplies. Here we wanted to leave you with some key contacts. First and foremost, we have a public-facing website in addition to the member portal and mobile app previously shown. The public-facing website at etf.benefits.navitus.com allows you to access information regarding your pharmacy benefits without actually registering or creating an account and logging in. The information on the public-facing website will be very general in nature, allowing you to do a pharmacy search, as well as access information regarding your formulary and coverage of medications. If you are looking for information specific to you and your account, that is where you would want to utilize the member portal or the mobile app, allowing you to log into your specific account. In addition, our customer care team is available 24 hours a day, 7 days a week, except for Thanksgiving and Christmas days. You can see here there are different phone numbers depending upon if you are a Medicare or a non-Medicare member. So please always look at the back of your Navitus ID card for the appropriate phone number for customer care. We do try and make contacting customer care as easy as possible. When calling customer care, there is not a long automated process to go through. You simply identify yourself as a member, select English or Spanish, and you will then be connected with a live agent, typically within 10 seconds or less. Lastly, Costco mail order. Here you can see a phone number as well as the website to access Costco. As I mentioned before, Costco does make it as easy as possible to enroll into the mail order benefit. You can create your account and set up a prescription transfer from your local retail pharmacy by going directly to the website or by contacting their customer service, and they will assist you in that account registration and getting enrolled and set up for the mail order benefit. I would like to thank you again for joining today's session of It's Your Choice for the ETF Pharmacy Benefits by Navitus Health Solutions. Thank you.